Cool. Well, welcome everybody. This is how Vanderbilt's enterprise data platform supports patient care and leading edge research. Thank you for coming. I know we're between you and dinner, and so I'll try to make this short and hand it over to Peter Shavy here from Vanderbilt. Full disclosure, I'm not from Vanderbilt. My name is Aaron Zavora. I'm the industry go-to-market lead for healthcare at Databricks. I'm just going to do a quick kickoff here for the group. And what I want to share with you is just how we at Databricks think about our go-to-market strategy internally and how we try to align with customers and help our customers. And so to kind of tell this story, let's go back 3 years at Databricks. We're a horizontal platform, horizontal technology for data processing and AI. And 3 years ago, we verticalized. So we said everybody that supports healthcare and life sciences is going to be in one group. And when we did that, we found that we saw patterns among how people thought and talked about Databricks, right? Patterns like, how can I take better care of my patients as a physician using data and AI? How do I take these disjoint operations in healthcare and start to streamline these processes? And then how do I start to deliver better patient engagement and better patient outcomes, right? Personalized engagement that I can actually change the results of healthcare. And so with this information, right, and this is where I would say this week by far is my favorite week of the year because we get to see the intersection of Databricks product, what the future of the platform looks like, as well as all the things that our customers have done in the past year. And I'll share 2 examples from last year's Data and AI Summit that I think really kind of drive into those patterns that we're seeing. Last year's CVS, and full disclosure, that's my background. CVS presented a use case on building the biggest RAG architecture. And they did it for the purpose of reducing tribal knowledge. Any organization that's set up is complex, and that complexity drives bottlenecks. And so CVS looked to say all those things of, hey, in order to get this done, go talk to this person, go find this document, go fill out this form. How do I make that information accessible and findable in a way that's centralized across the entire organization? Right, so how do I start to streamline some of those operations? And also, these are not the stories that I'm talking about here on the slide. But the other story that comes to mind from last year's summit that really stands out was a presentation from Mercy, where they talked about how coming into the emergency department, they were taking this complex set of information, summarizing it using an LLM, and then actually providing it back to the inpatient handoff team. And so a really interesting component of this is they talked about how they did it directly in the EHR. So they built all these great analytics in Databricks, and they didn't want that information to sit in a table, in a row, in a column. They pushed that back into the persona who's using the EHR, right, at a place where it's needed. Why that matters from a value perspective, and this is years ago, I heard HCA talk on this, that they said about 95% of medical errors happen on handoff. So whether you're going from the ED to the inpatient ward or you have a nursing staff change, right? So there's a tremendous amount of value in what our customers are talking about and what they can do with data and AI. So that led us to internally switch how we talked about Databricks. And so we talk about it in the terms of what are the things that you can do on Databricks that drive these outcomes? And we think about those outcomes in kind of these buckets of the streamlined operations, of how do I build better provider networks and drive quality of care with my providers, and then how do I do things like disease risk prediction, patient retention, right? Better taking care of my members, knowing who they are. And so this QR code here is available, and what it does is it just gives us a chance to get feedback from the audience, totally optional. But I want to share how we take kind of our feedback from our field, feedback from our customer stories, and how we operate internally to meet our customers where they are. And so we did a survey probably about 3 or 4 months ago internally, and we asked our teams, we said, what do providers want to talk about most? And the top answer by far was value-based care. What does Databricks do in the value-based care space? And if you don't know value-based care, I'll give you the TLDR. The idea is I'm going to deliver better patient outcomes. My provider's going to do less work, and I'm going to get paid more money for it, right? And so how do I execute on that? We came up with a framework for that. This is something that we're actively working on. And I just want to give a plug-in for a Q2 workshop we have for healthcare to be be able to solve for things like value-based care. We're running a workshop on July 15th. The link isn't public yet. Once it's made public, people can sign up, but we're doing a workshop on claims management. So if I can get all the information about my patients, about the procedures that are done, about the diagnosis that they have, right, I can now start to better take care of my patients in the terms of something like value-based care. We have a partner joining us as well, CDS Tech, for that webinar, and so that'll come July 15th. And with that being said, that's just a little bit of a kind of intro or a preview of kind of what we do behind the scenes at Databricks. And I'm really excited to welcome Peter Chafee, Executive Director at Vanderbilt, onto the stage to continue with our presentation. Peter, take it away.
Very good. All right. So just a little bit about Vanderbilt. We're based out of Nashville, Tennessee. We're a large organization, about 40,000 employees, 5,000 care providers all across multiple hospitals in the Middle Tennessee region. We serve obviously all of Tennessee and the Southeast. We have a large footprint in research in the organization, also in education. We're well known across the country for our transplant programs. We have patients that come from all over the country and beyond for many of the specialized procedures we have at the institution. A big part of what we have is based on research and advancing care. We have the largest informatics department in the United States based on our faculty counts. And with that, as you might expect, data is a key element in terms of driving a lot of what we do in the organization. Before I jump into all of that, our mission at the top level is really making healthcare personal. Vanderbilt's been known for personalized medicine for years, that being in genomics and pharmacogenomics space. But we've actually taken it a layer down and really look at how do we make the care personal for every patient at every encounter along the way. So looking at that is, like I said, not just genomics, but it's also how do we apply data across research, healthcare, and education, leveraging our staff and our caregivers to interact with patients in a way that helps them solve whatever problem they're looking to solve, provide them with the right care, the right information at the right time. Patients always at the middle. Given we're at a data conference, we're putting data as the foundation of this today, but it really all comes together as our overall mission. So I'm going to back this up a little bit and take you on our journey of how we landed to where we are today. And this will build up from where we started. But going back to 2019, we were actually running on a platform. Netezza was our data warehouse platform on-prem. And we were informed that that platform was going to go out of service, no longer supported. So we had a decision to make. Where we're going to go for there, what we're going to use as our data and analytical platform for Vanderbilt going forward. So fast forward to where we are today, that seems like an easy decision. Obviously we're here, but at the time we weren't sure exactly what to do. So we had to think about what are the constraints we have, what were our intentions, and what did we need to get from our data platform as we look to the future. We started by talking to our customers. So my role at VUMC is really coming out of IT and working with our analytical customers across the organization to provide them with the services and the data to solve their problems. We have a federated analytical landscape. We have various teams in various verticals providing support and analytics for local departments, as well as some that provide services to the wider community. Add to that our research organization, which is made up of hundreds of researchers, which have a varying set of dynamic needs and data needs across the institution. What we found is common needs around access to data, the need for advanced tooling, the ability to scale when needed, and several other, and also the ability to be compliant and maintain security was critical to all of these users. We then overlaid that with what are our existing platforms. Netezza is the one that I mentioned. Some of you may be familiar with that. And like I said, that was going end of life. So that was the driver. But on top of that, we also had a lot of other data warehouses across our environment. So some of the problems with this were each of these sources were oftentimes ingesting information from the same data systems or the same operational systems, sometimes stressing them. A lot of times resulting in different data sets and different data models. And as you can imagine, when those different teams reported off those systems, those reports may not always come out and have the same facts presented. So our goal was to try to bring that together, make more data shareable and accessible across the ecosystem, so that way we didn't have so much segregation and siloing of our data. Building on that, we laid out some platform goals. I'd like to point out this is a version of our platform goals as I see it today. At the time, it wasn't quite all as clear as you see here, but at the basic levels, it was we wanted to support research and operations. We wanted to make sure we were gaining efficiencies across the platform where we could. We wanted to, of course, make sure it was compliant and also have the ability to scale and grow to the future. So we need advanced capabilities. We didn't want to just do BI. We wanted to make sure we were ready for machine learning and AI capabilities, that were coming in the future. So that was kind of where our starting point was. At this point, we were already aligned with Microsoft Azure as our cloud provider, which was a key element here from our ability to scale. And Databricks at the time was the optimal solution given the capabilities that they were providing to be our service provider. So that was the starting point. I want to take one quick sidestep here and use this as just a principle or a backdrop for this as we go forward. We fundamentally believe that in order to make any platform work well, you have to make it easy for people to use. You have to have good customer service. It doesn't matter how great your solution is. If it's a pain for me to get to it, people aren't going to use it. It's just too hard. So I use the analogy here of I do a lot of do-it-yourself projects at home. Recently I was going to paint my daughter's bedroom. I think, okay, I'm going to get up on Saturday morning, take an hour, I'll get this done. The reality is I got to go and purchase the paint first. Then I realize I have to actually mud the holes she put in the wall. I have to go back and purchase the mud that I didn't realize I had to get, come back around, eventually get the painting done. Then you realize, oh, I had to go get more paint because it didn't cover. Finally, you got the cleanup. This little task that I think I'm going to pound out on a Saturday morning turns into an all-day ordeal. The overhead and friction in doing what I wanted to do ends up being great. In some cases, that leads me to not even do it at all, not even start. I would argue the same thing comes to our users in the data space, where there are a lot of questions to be answered, there are a lot of problems to be solved, but if the overhead for those users is too great, they never even go to try to answer the question. It doesn't pay. So our goal was to figure out how do we remove as much of that friction as possible to allow our analytical teams, our researchers, to go and do the work they're trying to do without having to worry about all of that additional overhead. Really allowing them to focus on the analytics and the machine learning and the data science, and us manage the platform and surface this in a way that they can easily gain access and be effective. So now into our actual model and where we started. This is circa 2021. We actually started this project in 2019. We were at the very early stages of the lakehouse architecture. And with that, we had some growing pains. But we started out with our core mission to bring in the data that we were currently using for operational reporting, landed in a medallion architecture here, bringing in raw data and then modeling it into our enterprise data model on the platform, and then servicing that up in Databricks workspaces and ultimately making it available in our Tableau environment. We are heavily a Tableau shop. Today that's evolved a little bit, but at the time, Tableau was a requirement for us. So a key element here was the lakehouse architecture allowing DB SQL to connect to Tableau natively was a game changer. Without that, this wouldn't have been possible. But we were able to do that. We actually went, when we went live was like within a month of DB SQL going GA in 2021, if I remember correctly. So it was very, very early. A few lessons learned along the way here. We made some decisions. We used workspaces as our key security boundary and sizing boundary. So for the various teams we had, our enterprise analytics team, which was 30 or 40 users, we had a larger workspace for. And for some teams that were smaller, we had smaller workspaces that we spun up for them. But we were able to then mount the appropriate data assets to those workspaces so they could continue to do their work and deliver the reports and dashboards that they were previously delivering on our legacy platform. A few other decisions we made along the way here was some optimizations. And this came from I would say, our great team and their ability to play and test things. We did a lot of A/B testing. At the time, actually the session before this was talking about cost management, and some of those cost management tools that are available today, I wish were available back then. But what we ended up doing is we ended up running different cluster sizes and running our ETL jobs through those clusters to see what version or what type of compute made the most sense to optimize cost and performance. With that, we were actually able to run our ETL jobs in about 3 hours on a nightly basis. Previously, to run full jobs on our previous system took about 2 days. So that was a significant performance enhancement or performance advancement. Additionally, we optimized our way of building ETL. We were historically building our enterprise model out in an incremental fashion every single night. So for all of you here who have built ETL jobs before, anytime you're building incremental type jobs, there's additional complexity, there's catch-up jobs, there's quality checks you have to put in place. we found that on the Spark platform using Databricks, we could actually run a full, complete refresh every night in less time and for a reasonable cost that allowed us to maintain our model that way rather than using incremental jobs. That significantly reduced our labor overhead in terms of having to maintain incremental jobs going forward, and just simply made the platform easier for us to manage. So that was a nice decision point and a change in architecture from what we'd done previously. All right. We were successful with that. We got it live. That was great. Then it came around to the next year, and they said, congratulations, thank you for doing that. Now we also have a research Netezza box in our environment, and we have the same problem. So we need to take and move our research derivative and synthetic derivative to the cloud as well. Our RD and SD, as we call them, is a de-identified and an identified OMOP data model. This is an asset that VUMC has built over the last couple of decades. It ties into our biobank. It's a significant asset for IRB-based research and research across our institution, and previously had a completely separate team managing and building this model independently and running the architecture and the infrastructure behind it. What we did, we layered it into the exact same platform. We added some new data sources on the far left side over there. We had to add some new data ingestion features, the ability to ingest from file as well as from APIs. And we landed the data. We brought that team up on how to utilize Databricks to run their ETL. They converted their ETL to Databricks and Spark, and we're able to convert the research derivative to run in the same platform. Now, in our data lake, we have the enterprise model updated daily, as well as the research derivative also available, sitting right next to it as another fully built model, that one being OMOP based. In doing so, we ended up adding some more workspaces. We went from a dozen to dozens of workspaces because we had researchers who began to adapt to the platform, gain access to data, and leverage the tooling. We also had, I like to call this out, I think it was over here, I don't know if I can use my pointer, but on the far left side, you can see the REDCap research pointer there. For those of you that are familiar with the research space, REDCap is a research survey tool, essentially a research tool for collecting data. It was built out of Vanderbilt. It's used widely across research institutions in the United States and around the world. And what happens in most research cases is they're working with a cohort of patients. They have their live data. We were able to deliver that through our process that we already had in place. But they also go and collect research data in a REDCap project that they create. So the researcher creates that. They're collecting that data over here. What do they have to do? They're then extracting the data from there and trying to bring it together, maybe working with that data on their desktop, maybe loading it into Databricks, but it caused extra work for them. So we created a REDCap adapter. Essentially now, there's the ability from a researcher perspective to have push-button synchronization of their REDCap project with their workspace in Databricks. So I have my workspace, I set up my project, I have my data cohort of patients coming into that, I'm seeing their data being updated daily, and my REDCap data that I'm also collecting on that for whatever aspect of the project that's relevant here is also flowing into the same workspace. Mounted next to the other data, easy for me to model, being upgraded and refreshed daily with very little friction. Again, back to that friction thing. It makes it easy. They can work on the work they're trying to do and not mess with the plumbing. So that was a nice addition that we had here. I also think, if I recall right, I think this was the period when Photon actually was made available too in 2022. I'll just one quick call out since it was mentioned earlier. We actually found when Databricks released the Photon engine, we actually saw decreased cost and increased performance in our ETL jobs. So that was a nice finding along the way. Fast forward a little bit further, we moved to the synthetic derivative side. This is where we went to creating our de-identified data model. Again, this is a model that we've actually had in place for a number of years. And when migrating it to Azure, to Databricks, we had to, again, take and convert all of the existing ETL. What's significant about this is it's not just moving the data, there was a lot of transformation involved. Millions of notes are using NLP here to basically de-identify and remove data elements from those notes and obfuscate the information to make it safe for downstream research purposes. That was a pretty significant lift. Again, we added more workspaces, more researchers, more users. At this point, we realized, probably not a surprise to anybody here, but cost management was becoming a bigger and bigger issue for us. So we had two types of users. We have institutional users who are funded workspaces by the institution. But on the research side, we actually charge back all of the usage and the cost to the researcher grants themselves, so that gets reimbursed. So we went from that being a fairly manual process to automating this. At this point, we now have monthly bills that are going out to all of the various research studies based on workspace usage as well as storage consumption. And that's part of how we manage this and provide that, again, that mechanism for the researchers to be able to leverage the resources at whatever capacity is appropriate and bill it back to their grants. Probably also worth mentioning here, we started to make a more significant effort also in what I would call our gold layer, really the data sets and the problem-aligned data marts that were created. And with that, we actually surfaced those as Power BI data sets on the backside of Databricks and made them available as part of our platform as well. So here we are today. The platform as a whole in 2025, we're over 150 different data sources that are ingested. Most of these are ingested daily. Some of them are ingested hourly. A few of them are less frequent than that because of the type of data that's being ingested. But that all flows through, lands, has the right quality checks, ends up in our system, and is made available through Unity Catalog today to the right workspaces and granted access to the various researchers or operational teams that need access to those resources. I'll point out Unity Catalog was a big advantage for us. I mean, all the features that you have heard about it, are part of it. But it was a year plus effort for us to transition to it. So that was an effort because we were so early on our platform. But now we have the vast majority, I don't know if I can say every workspace, but the vast majority of our workspaces have been converted over to Unity Catalog today. Along with that, we have started to make use of the Databricks AI BI type dashboards. Some of the announcements even announced this week are give me optimism, I guess, in terms of some of the possibilities we may have there, and leveraging some of the other Databricks tools that have continued to come into our ecosystem. So that's been some real nice wins for us. I'm not going to read off every one of these little tags, but every one of these essentially amounts to an optimization of some point. I talk about that friction early on, my goofy little painting analogy, but still it comes back to everything we could do to make the system easy for our users was critical. And that was really the focus, and it continues to be our focus today. If you want to know the experience today for a new researcher who shows up at Vanderbilt and says, I have a grant and I need access to data, my IRB gives me appropriate usage to use this data, they essentially can put in a ticket with us, and we're talking about a matter of hours for us to be able to provision a workspace, mount the inappropriate data, give them the endpoint, and they're up and running. That's how it works. No standing up new VMs. We also allow for various compute sizes. We actually did have to do some work there. We created a t-shirt model sizing chart for people so they'd have an idea of what would the costs be. Obviously, as soon as people are accountable for the costs, they care a lot more about the costs. So that was a key element along the way, and we continue to be on that journey together, I would say. But the experience today is so frictionless, I would say, for most of these use cases that it makes a lot of this work really possible really easily. All right, touched a lot on building the platform. That's the part that we've done a ton of investment on. The part that our customers really make is around usage of the platform. So they use it for a lot of different use cases. I'm going to touch on a few of them here today. These are not directly use cases that I necessarily can take credit for. These are our customers who are then leveraging the platform for downstream use cases. So I'm going to touch on these for just a moment. One of our oncologists that we work with, he's very active in the data and analytics space, and this is one thing that he brings up regularly. The fact is, new therapies are constantly coming out, and really, especially when you're talking about first-in-class drugs, they can be life-changing to patients. What happens is, I might be a patient, I may have exhausted all of my options, a new drug comes out, and the key is, how can I make sure, as the caregiver, that patient who might have an opportunity to leverage that drug gets that information as quickly as possible? Well, kind of the old way of doing this, or the conventional way is, the information comes out and you just, tell the providers about it and say, hey, make sure you remember to do this. What could go wrong? It's not that people aren't trying, but there's just so much information. How do you bring that together? So instead, we take a slightly different approach now. This is our common way of going about this, where that new drug comes out. In this case, they can quickly do a query across the lakehouse, identify the patients that would qualify or at least potentially qualify for leveraging that drug, find out who their oncologist is, look at where the next appointment is for that patient, break that down by care team, and deliver that report. So over the next 2 to 4 weeks as those patients are coming through the system, the nurse or care team can counsel them to see if that therapy might be of interest, and then they can have the subsequent discussion with their doctor and determine if it's reasonable for them. It comes down to, again, precision care, offloading that burden, not asking somebody to just remember, and giving them actually an operational work list to work from and go and it's so much easier. It's just easier to go and have that interaction, and people feel confident that they're doing the right thing rather than worrying about constantly, am I missing something or where was that at? So pretty simple use case, but again, possible because all the data across the platform is available. This one got a little bit more complex, and this one is a little more operational as well, but imaging site optimization. We have a number of cases where patients are on specific research studies, and because of those research studies, there might be requirements for imaging to be done at a certain type of site. Our primary imaging site on our main campus, for example. Well, because of that, what we've done in the past is if a patient was on any study and they needed imaging, it would get scheduled on main campus. As it turns out, main campus is also our busiest imaging site, where we have all of our trauma and other imaging being performed, which means that we're putting extra stress on the system. And on top of that, it may also not be the most convenient site for that patient to be seen at. So if the patient's coming from out of town, maybe there'd be a regional site that would be easier. What we did in this case is, again, leveraging the same platform. We have a number of different sources. In this case, I'm talking about IRB data, as well as our CTMS and our ERP system and EHR information. Bringing that together, we pulled an analyst in, mounted that data so that she could take a look at it, and build out a model leveraging this information to identify, based on the rules, which research studies required main campus imaging and which ones did not. This actually, we have not finalized the implementation on it. We're on the final stages of it. But with that information available, our next step is to inject that into EMR, into our Epic EMR, so that way it'll be additional decision support for the scheduling workflow as they work through it. In this case, like I said, again, hopefully offloading some of that load for our primary center, also making it better for the patient in terms of what's convenient for them. The last example I want to touch on here is transfusion risk prediction. This is a study that was done at Vanderbilt over the last few years. And the intent of the study was to identify, based on a procedure a patient's going to have, what is the risk of a transfusion being needed. High risk of transfusion means it's more important that you type and screen the patient for their blood type prior to that procedure. Well, you might say, why don't we just type and screen everybody? Well, obviously, maybe not obviously, but the resources to do that just don't make sense. So it's the question of how do you make sure you type and screen the right people? Well, the team that worked on this were able to create a predictive model using Databricks and MLflow on real data in our environment. And with that, they were actually able to identify, more finely tune the patients that would need to be typed and screened based on the transfusion prediction. We actually took that information and we've moved that. We've actually operationalized this today. We have a process where when a surgery is scheduled, it actually kicks off a downstream agent, which essentially takes that information and then queries Databricks. We're using the model hosting in Databricks, so an API is delivered there. It evaluates the model for the patient, takes that information back, and then injects it in the EMR. At that point, the anesthesiologist on the pre-surgical workflow, as part of their navigator, gets presented with that information in terms of decision support to advise them on whether or not this patient should be considered for type and screen if they have not yet already had that order put in place. The plan in the future is actually to move that up the stream to the surgeon as well, but right now we're working with the intervention at the anesthesia layer. The result of this, I mean, maybe it's obvious, but the result of this is ultimately trying to get the right blood to the right person at the right time. Obviously, we have ability to leverage emergency blood, but if we can, the better option is to have the right typed blood for the patient if needed. So I'm going to finish up here just with taking that same workflow, and this ties into where we're headed in the future here with the agentic-based architecture and where things are headed. I want to point out, we don't have this solved yet, but we are on the fringes of it as we're working along. That example I just talked about, we have essentially messages coming in, and we manage those messages. Those messages that come in then can trigger events and trigger downstream components. Call them agents if you'd like. I mean, that seems to be what everything's called these days. But the idea is that downstream component can then take and make some decisions. It can call in, evaluate something on our data services plane, Databricks being the key element on that part of the slide, and then actually take a business action on the back end. Doing things like I said, injecting workflow information into Epic or into our EHR. In some cases, we're placing consult orders or potentially sending a patient message to MyChart, or My Health at Vanderbilt is our EHR, or our branded version of MyChart, and making that data available for actionable insights to the provider or the user wherever they're at. So this is kind of how we're operating things today. I'm excited about some of the announcements that were made this morning even in terms of how we can potentially better orchestrate this. This is a little bit hand-woven at this point, but this is where we're headed with some of these capabilities. I'm not going to touch on the myriad of additional use cases that we could refer to that we're leveraging the platform for today. But just to wrap up here, I'd say some of the key things that we found on our journey was, number one, bringing the data together. Number two, bringing the people together was critical. Reducing friction wherever we could. And then in our world, anything we could do to leverage that to make healthcare more personal was the goal. So with that, thank you.